So what we are trying to do is that we have to learn the what is the meaning of occupational therapy in the context of a person with disabilities and a person with normal, take normal person, what will be the better impact of that person's with have that. So we have learned about that there is a complete difference between the occupation therapy and occupations, because when we are talking about that what is the mean of occupation, we have only seems like a jobs, and it like any specific skill that will be help in earning the money and any contextual for the context of skills. But when we are talking about that what is the complete difference between a normal person and a person with disability, because there is a impairment in the particular persons, that's why there is a need of something else to add on the physical disabled children, to make him then the mainstreaming, to make part of the mainstream where he can as equal as a person as a normal persons. So we have discussed about that when we're talking about that only occupation, that means it will be a job and a specific skill that will help you to earn and to provide lifestyles. So when we are talking so there is an example of that particular things that if you're talking about that a person who have to requirement of a skill that is related to computer skills, and we are that there is also a person with physical disability, he also needed some kind of skills that are related to computer and any other type related skills. So there is a complete difference between the, there is a similarity between the typing and any other, for example typing, there is a similarity between typing of a normal person and because typing is equal in one laptop and one desktop in any computer, but the persons who belong from physical disability has some kind of sort of skills, he come sort of skills, that's why he have not the that kind of intellectual property, intellectual power to uh, help the people to learn faster than a normal person, because we know that normal person has the more ability to towards than children with physical disability or person with disabilities. So we can't take him that there is a same occupation therapy for both them. So in the context when we're talking about the occupational therapy, it directly concerns about the persons with disability. It doesn't seems to help the any kind of normal people. It will directly related to, because there is a complete difference between occupation and occupational therapy. When we are talking about that occupation, then it will be same for both the person with disability and the normal person, but in context of occupational therapy there is a complete difference between them, because if normal person doesn't need to have occupational therapy because he have the particular skills and he can learn easily and better to and with the without the help of he can learn the particular occupational therapy. But in context of learning physical children with person with disability, there is a lack of intellectual power, there is a lack of motor skills, any kind of lackness. So we have to just deliver about that what we are trying to do in that particular therapy in occupational therapy. So occupation therapy is not related to as same as occupation in context of physical disability, because in context of physical disability occupation just means about to teach them to how to build a life, and it will needed what kind of skills requirement for to live a beautiful life and independent living. When we are talking about the UNCRPD mentioning about the independent living, it will be there is a complete history of the to work about the skills set for the children with disability in 1986. National Education Policy also mentioned that we have to teach the person with disability to some skills that he can sort of out of uh, his lifestyle, he can easily access his life, he can easily live with the dignity of his life. So occupational therapy help the persons to person with disability to learn that kind of skills that are which are necessity for any person. It doesn't directly belong to a person with disability, it also belong to a person with is a normal, which has normal potentials. So these are skills both common for persons with normal person and person for the physical disability. But in context of physical disability, there is a significant challenge is that the person disability doesn't have that potential, and there can be an impairment or disability, the factor that can reduces his potential to learn about that particular skills. So in the context, that's why we needed a therapy counseling, and that will give the by any one of the professionals which has the complete degree on that particular knowledge, ki how they can teach treat and how can they enhance these kind of life skills which is required to in that particular situation, in that particular settings for a normal persons and for the physical children with disability. Because there is if it is seems to be a normal person, they will be easily understand what they can learn about that skills. But in context of physical disability, they don't know about that ki how to work on that life skills and how to learn that these skills and how to do that skills. Because in some severe cases, there are people who are significant causes of many impairment in the organs, and then that doesn't help in them to learn about this life skills like and when we are talking about that, what is life skills, so we have to learn about that. If we're talking about that key in occupational therapy, there is a thing that key we have to teach them, and the professional teaches children with disability about the life skills. Then what is the life skills? We have to first explore the what is the reason of occupational therapy, that is the life skill, and what is the objectives of life skill and what kind of these life skills are. For example, if we are so we can follow a daily schedule of any normal person, then we can understand what are the basic skills that are necessity for doing a life, yeah, running a life in everyday moment. So when we talk about that key in early morning, when we are uh, wake up, then we have to first complete our brushing, we have to clean our mouth, and we have to bath, we have to take bath, and after that we have to prepare lunch or not be prepare lunch, but we have to know about that how to take it, how to take meal. And after that we have to learn all gardening and the skill of washing the clothes and grooming ourselves, and this kind of the skills that are required for and to learn about how to take a pencil and how to write. These are the basic components of a life skills that are required for any persons which have to live in the life. If he doesn't have any kind of severe disability, like uh, if he has the severe case of mentally retardation, then he will not able to do these things with themselves. So he doesn't need of a persons who can assist them and who can help them in the things. But in case of normal and mild case and moderate case of physical disability, then we can teach them to in better way to how to grip our that skills and how to learn about these skills that are requirement for the life, to learn life with individual. And it does directly can be individual independent. There is a term individual independence, that means ki we have to build its potential in persons with their on the level of the particular persons. We have to just teach them there is a solution to for every skills. For example, if we teach them the basic fundamentals of brushing, then he can at after regular practices, after the 1 to 2 months of practices, he will be able to brush the phone. Because there is not a big task that towards the brushing, but in the functioning of the prior child, in the primary child and the children with disability, there is a seem like it is difficult process. But if we take them the particular lessons and training, then he can easily know about how to brush the teeth. And after that we can teach them to how to uh, wash your clothes. That is very essential to learn that ki there is a clean mindset about that particular uh, things, any kind of like burtan, it's utensils and any other things. So we have learned about that ki occupational therapy and occupational therapy. The main objective is that to first that is ki we have to build an individual independent living. In one, number two, there is a occupational skill. There is a life skills needed for that. So he can be a self-esteem. He can get a self-esteem. He can build a self-confidence. And the third one, that thing is that ki, some cases, if we teach them the little bit extra skills that can relate it to life skill. If we uh, train them for any kind of gardening works and any kind of machinery, little bit machinery work like fridge of maintenance and any kind of washing the clothes, and then he can create a job for himself as a labor class, or I don't call to